Well, I originally came from northern Alberta. I was born in a very small Métis village in the far north. My mother's side of the family is Métis. And when I eventually went to university, I did a science degree in Edmonton and then a medical degree at Calgary, and eventually came to Vancouver to do family medicine. But I also started doing work at BC CDC in what was then called the STD clinic. This was in the height of the beginning of the AIDS epidemic. This was in 1986, 1987. During this time, as I started working at the STD clinic and started encountering a lot of gay men, here's my, awakening to what homosexuality really meant. So coming from my sort of redneck background and suddenly having to deal with my own, I guess, innate homophobia was an incredible learning experience for me. I found that as I met gay men and got to know them, my homophobia melted away. And I remember around that time I started attending the global AIDS conferences, and there was one in San Francisco, and at the same time they had the conference, they had their gay pride parade in San Francisco. And what an amazing spectacle that parade was. And I thought, wow, this city has really embraced gay people. The homophobia and fear that I'm accustomed to seeing doesn't seem to exist here. And then later, I read an obituary in the newspaper here, and it was a story of a San Francisco broadcaster who had done an AIDS diary up until the time he died. The story was commenting on how big an impact that had had in San Francisco. And I thought, wow, if he could have an impact in a city like San Francisco where, from what I could see, there was very little homophobia, maybe something like that could happen here and have an impact in Vancouver. Around that time, I had an office at BC CDC, and down the hall from me, a young physician, Dr. Peter Jepson-Young, was working in a different division of BC CDC. And one day he came and approached me and told me that he had AIDS. So this kind of shook me a little bit to learn all this. But at the same time, it occurred to me that with this idea I'd been sort of nurturing, that maybe we needed somebody to put a face to AIDS. So I proposed the idea to him that maybe an AIDS diary would be something he might consider doing. We eventually met with somebody at CBC, David Paperny, who worked in the news department there, and he took it back to CBC and sold them on the idea. And over the 2 years that he did the diaries, he became incredibly well loved. He and I became very close friends during this time, and it was just, it's hard to describe how moving it was, because he became so well loved and he contributed so much to reducing the fear of homophobia and the fear of AIDS in this province. And I think he made a hugely important contribution by doing those diaries. In the end, Peter did 111 weekly diaries, and his last diary was done 2 weeks before he died. And as we approached that point, Peter recognized, as did the others of us who were close to him, that he had generated a tremendous goodwill associated with his name, that we could perhaps capitalize on that in some way to help other people with HIV/AIDS. And Peter was very conscious of the fact that he had had optimum care, both because he was a physician and understood the medical system, but also because he was surrounded by loving, caring people who did everything they could to support him. And he was aware that many people with HIV/AIDS didn't have that level of care. And so his idea was that there was this concept he had of comfort care, that he wanted us to somehow work to make that more available to other people. What I think is really remarkable about all this was that phenomenon of attracting the right people at the right time, and one of them was Maxine Davis. In the years since, I've worked in big management positions where I've done a lot of hiring, and I always think that probably without a doubt, the best hiring decision I ever made was when I recruited Maxine Davis to be the director of the Dr. Peter Foundation.
in 1993, when I was working with the Vancouver Health Department, and I was the Assistant Director of Continuing Care Division at the time, I got a call asking if a group could meet with me to talk about an HIV/AIDS day health program in Vancouver. They felt with Dr. Peter's name attached to the project that would inspire support of government and others. At that time, the Dr. Peter documentary, the broadcast tapes of Dr. Peter, was nominated for an Academy Award. We suggested to the foundation that they have a launch event. And I remember standing at the podium saying, you know, this needs assessment, we don't need a greener light than this. After the Academy Award event, I got another interesting call, and it was Dr. Jay Wortman. And he said, the foundation would like to ask you if you would ask your employer if you could take a leave of absence to come and get the Dr. Peter Center up and rolling. I knew in my heart what I wanted to do, and I said yes. We were still struggling to find a location, and we had this big dream of a Dr. Peter Center, and it had, you know, it had to be a big building, and it was new. At that juncture, the old Comox building that is still there had shut down. It was an empty building, and the plan was to tear it down. In the process of reopening the floor we needed, the City of Vancouver inspector came to help us give the okay for us to use this space. And I still remember what he said to me. We were on the floor, and this was second floor psychiatry in its last life. And prior to that, it was a movie set for a psych ward. So it was really, the tiles were falling down, the wires were falling down. And this city inspector said, "What the fuck is St. Paul's Hospital doing letting you guys come back in here?" And we are ever so grateful that St. Paul's did. And I still remember Tom Ward was the CEO of St. Paul's at the time. So I come back to my office, and there's a voice message from Tom Ward. And you kind of have to know Tom to get his voice. "Well, Maxine, in the words of Captain Jean-Luc Picard, make it so." One of the keys for us to making a step forward from the old Comox building to obtaining a new site was that we did a study, and it was Dr. Thomas Kerr actually who did the study. It showed that within 1 year of an individual attending the day health program, they reduced their acute hospital utilization by 55%. We made a silk purse out of a sow's ear over there. It was also a dress rehearsal actually for our new building, because we were able to design the building based on what had worked. We moved into the new building. Some of our clients actually really missed the old building. Providing health care to a vulnerable population struggling with HIV, hepatitis C, serious mental illness, serious addiction issues, homelessness, is actually one of the biggest challenges in healthcare in this country. And we have made a tremendous contribution to having a deeper understanding of how to do that. We're at a tremendous point in the history of AIDS. In a lot of ways, I don't think any of us could have dreamt that we'd be at this point in 2013. Our mission was to provide care for people living with HIV/AIDS. We are now moving towards a statement which is that the Dr. Peter Center is providing care to end HIV. We know that if we can engage this vulnerable population in healthcare and get them engaged in HIV treatment, it is literally helping turn off the tap. What the Dr. Peter Center offers is that we walk with people in their suffering, and that's the gift we bring them.